So deaths get reported to us via a variety of mechanisms. And so whenever a death is reported, it could be reported by the facility where the person expired. It could be reported by the medical examiner. It could be reported by the Ohio Disease Reporting System sometimes is how we find out. It could also be reported by an emergency department. So there are a lot of different ways that we find out that people have died. And with every single one of those, we actually go back and verify the lab that confirmed the person was positive for COVID-19. So when I present the fatality data every Friday and you see the daily numbers on our website, each of those that are listed under lab confirmed are somebody who died of COVID-19 infection-related complications. So they all have lab confirmed deaths. And the numbers we reported out this morning were 104 lab confirmed fatalities in our jurisdiction that is separate from the city of Cleveland, who also have a significant number of lab confirmed fatalities. There's a second group of fatalities as well, known as probable cases. Probable cases are individuals who have an epidemiologic link, meaning they are a contact of someone who is a lab confirmed case. And so we report out probable cases, and the Ohio Department of Health asked us to begin a few weeks ago reporting out probable deaths. To date, we've had only one death of a probable case in our jurisdiction. That was somebody who had that confirmed link to a lab confirmed case. I suspect in the coming weeks, we will see more of these as the deaths really lag behind the case identification. And in some cases, these are deaths of people who were diagnosed weeks ago. And in some cases, the first we learn about them is actually at the time of their death. So earlier today, I had a report, which is not reflected in the numbers I just gave you, because I usually do the fatality reports at the end of the day. But it was somebody who we didn't know about, who just presented to the hospital and unfortunately expired very quickly and had a COVID positive test at that time. So, you know, we learn about the course of illness differently depending on the circumstances, but every single one we report is carefully vetted to ensure that this is truly a COVID-19 death.
Okay, great. Yeah, that makes sense. And that kind of answers my other question is, are there different classifications of COVID-19 deaths? So there are, lab confirmed and probable are kind of the two classifications. Okay.
Correct.
Yeah.
I was just going to say, if someone's in a congregate living facility or a skilled nursing facility or a long-term care facility, and they have been exposed to others in that facility who are lab confirmed and they die, then that would be considered a probable case. So in some cases, it is an exposure out in the community, at a party or at a gathering or something like that. And in some cases, we call those household exposures or family and friends circle of exposures, but it could also be an exposure in a congregate living situation. And so I suspect we will see more of those, but we are very committed to testing and increasing testing, as we talked about this morning. And so we're hoping that we will have more lab confirmed cases rather than the probables, but with a limited amount of testing. That's why you're seeing probables reported. But we're very careful about the case definition for probables, both for cases and for fatalities. There is no reason to inflate any numbers at all. This has got to be transparent and clear with the public about the true impact on our community.